I'm Sarah with Modoma. I'm here today with Kim, and we are talking about the different types of medical equipment that we have here at Modoma, ready for you to help you make you feel better and get you to where you need to be. So before we get started, you can go to modomamassage.com to get started with an introductory massage package. But Kim, tell us all about the goodies that you brought for us today.
So first off, one of the main reasons our patients come to see us is for kind of chronic upper neck and lower back pain.
Right.
A lot of that is actually because of your posture. We live in a very forward flex society where we are constantly hunched over a computer, on our cell phones, yes, all of that, okay? And so some of the things that can be corrected, such as just making sure our posture is upright, can actually alleviate a lot of the symptoms that we're having. So the first thing that I wanted to show is the MidBack Brace. It looks like this. You basically would put it on like a backpack. And I like to put it on this way because it's easier for you to put it on and off yourself. So you pretty much just slide it on like a backpack, and you see where where the alignment of my shoulder is. We want your shoulder and ear to be in alignment because that actually is what's going to pull the chest back and pull the shoulder and neck muscles down to alleviate that tension and tightness. So we recommend actually wearing this. I love to tell my patients to wear this while they're working, especially if they have a computer job, because it's real easy to just slap on while you're on your computer doing things. We do say not to wear it any longer than 2 hours a day. It'll start rubbing here and you're like kind of in this area, and so it can be irritating. Sometimes with patients with shoulder issues, we may tell you to hold off on using it, but also don't drive or sleep in it just because it can be restrictive, because we do want your shoulders to be back here. The whole purpose of these devices is to help with muscle memory. The more you wear it, the more your body is going to respond to naturally trying to correct its own posture.
So about 2 hours a day.
2 hours a day.
And that doesn't look too bulky. Like that looks like something I could throw under a blazer or something like that to even, I mean, that's really great.
Absolutely.
Awesome.
And so this is like, I was like, I have my jacket here, but you can definitely put a jacket on. It's very lightweight, easy to travel with. So if you're a passenger in a car or in an airplane, it's a good device.
Can I try it on?
Absolutely.
So it's probably...
These will be fitted for your size. So this is a medium, so it may, yep.
Okay.
And pretty much like this. Now this is a little bit, there are Velcro straps here. And so these kind of get fitted. This one might be a little bit too big for you, but
I get the idea.
Absolutely. And so you can kind of feel how it kind of is pulling that posture back. Yes.
But it's not like a huge difference. So it doesn't seem like it would start to hurt or anything like that.
Yeah, it's definitely something. Our patients love it, and we definitely highly recommend it.
Cool.
So that is for kind of like your upper back and neck and shoulder pain. This next device is our lower back brace, okay? So this kind of goes on. Now this one is a little bit more cumbersome. However, patients who have the lower back strain, it definitely is helpful because it allows for your core to be stabilized. So you can see, you kind of put it on like it's a weight belt actually. And so it just goes on like that. And so it holds you in here in the core. And then there is a kind of like a disc that basically runs along your thoracic and lumbar spine to stabilize it. So it basically helps to alleviate some of that pressure in the lower back that a lot of patients feel. A lot of it is because we have poor abdominal muscles. And so this is just kind of an adjunct to the therapy while patients are doing their rehab to stabilize those core muscles, those core abdominal muscles.
Cool.
So you can kind of see how that works on there. Again, we say don't use it longer than 2 hours, and don't sleep or drive in it because it can be a little bit restrictive. Yes, absolutely. And you can see that these are easy to get on and off, and that's the whole point of it. It needs to be something that works for your lifestyle, easy for you to get on and off. And you can kind of see in the back how it kind of like feels like it just keeps you upright and tucked in.
Yes, exactly.
Absolutely, yeah. So if you have like radiating pain, a lot of patients have like radiating pain going down the legs. That's a term called sciatica. This can help with some of those symptoms because it kind of helps to position the body and kind of shift the body to where it needs to be so it's not compressing on that sciatic nerve. The final thing that I wanted to demonstrate is our TENS unit. So the TENS unit, a lot of patients have probably tried this in like a physical therapy or chiropractor's office. Basically, it is a small device that is actually pretty portable. There are patches at the end of it. And I just want to point out that all of these devices, our medical assistants actually will go over with you whenever you first get it, so that there's no issues with any questions on how to use the devices. There are patches here. You apply the patches to wherever you have muscle tightness. The TENS unit works using electrical stimulation. It helps to prolong those muscle contractions so that you get good blood flow to the muscles. A lot of our muscles were so tight and contracted in certain areas. When you apply the TENS unit and it forces those contractions, when good blood flow starts to get into the muscle, it helps to decrease the pain and it helps to oxygenate the muscle basically.
Yeah.
So you can see this is very small. There's actually a device to kind of like hold it in your pocket. You can apply it pretty much anywhere on your body where there's a muscle. We do just say don't put it on your face, scalp. Don't put it on your anterior neck here because you do have pretty important vessels that are here. And don't put it on the bottom of your feet. Anywhere else though is pretty fair game in terms of using it. And this is, a lot of our patients love to use this. They'll use this at work. They'll take it with them because it's so small and it's able to give kind of an instant relief for a lot of patients until like their next massage.
And so you can like kind of turn up the intensity.
Exactly.
And turn it down.
You change the frequency as needed for what your needs are for that particular day. And so there are instructions that come with it comes with its own little box, and there are instructions that come with it. But like I said, if there's ever any issues, our MAs are always happy to go over that with the patients.
Awesome.
We also offer wrist braces and knee braces. Those are things for that patients also need for certain issues. If you have any sort of tendonitis in the wrist. New moms, a lot of them will come to us with what we call like a nursemaid's elbow from holding the baby.
From holding the baby.
Yeah, so a lot of times a wrist brace with what we call a thumb spica, that is a brace that basically holds the thumb in place, kind of helps to provide traction in the forearm to allow some relief from the overuse.
Kind of like a carpal tunnel?
A little bit,
but
yes.
Not,
yes,
not
it's similar. It's
okay.
similar. And we do have the ones that are without the thumb spica, so our carpal tunnel patients use those ones usually. Yeah.
Awesome.
Yeah, so we offer, these are excellent tools for our patients to use and for anyone with chronic pain issues to be able to have in their repertoire for days where they're hurting and not able to get to us.
That's a good word, in your repertoire. Pain relief.
Yeah.
So guys, thank you so much for tuning in. You can go to modomamassage.com to learn more. You can get connected with your introductory massage offer, and you will come in and whatever your body is in need of, we're going to help you get there. So thank you so much, and you guys have a wonderful, wonderful rest of your day.
Happy Thanksgiving.
Bye.